Well, very recently, the Tri-Board President, Jennifer Wilson, and the Sydenham Board President, Christina Hammerline, went to the LHIN and made a request of the LHIN for a 5-year reprieve for the Wallaceburg emergency. All of the nurses were very gratified to hear that our board members are listening to our concerns. We are hopeful that the LHIN will hear our board members, our leaders that are representing us, and grant that 5-year reprieve. But even if it's granted, there's a larger issue here, and the larger issue remains that Dalton McGuinty is not funding hospitals appropriately. Hospitals and healthcare need to be funded appropriately. We need actually to be adding services to community, not trying to downsize them. You know, certain groups should not be almost bribed with carrots like a primary care center when it's at the expense of an emergency room. We believe that all of these new services that we hear our leaders speaking about, primary care, preventative medicine, Aboriginal health, all of these wonderful things should be in our communities, in addition to a fully functioning emergency room. And we also believe that at these small hospitals, specifically Sydenham Campus, we should have the ability to admit patients to a medicine unit. The number of beds apparently is up for grabs. That deal has not been made, but that's what makes a hospital. When you take away the ability to admit sick patients to a building, and you take away an emergency room and replace it with an urgent care, that building is no longer a hospital.